Daisy Morales sells food on the streets of Katia, a working-class neighborhood in Caracas. The ongoing economic crisis and the lockdown are having a big impact in her life.
We are only working 3 hours a day. I understand they are doing it to protect our health, but I'm a single mother of 2 children, and my eldest daughter and her son also live at home. I think the situation will get worse every day.
Security forces on the streets are trying to enforce a lockdown to prevent the spread of COVID-19, but people are becoming more and more desperate every day. On Thursday, reports of looting and clashes with security forces in several states around the country show how dire the situation is. COVID-19 may generate fear among people, but surviving every day is the main worry for many. Government figures show that Venezuela has around 300 confirmed cases of COVID-19. President Nicolás Maduro says the country has tested over 200,000 people with the help of the Chinese government.
That is the medium-term goal. We have to reach 1 million tests. At this stage, we've carried out 250,000, but we have to reach 10 million tests to comply with the complete protocol of the World Health Organization.
There are 2 types of testing being done: the PCR, that tests the virus genetic material, and the rapid tests that are less sensitive than the PCR. That's why doctors like Julio CASTRO say the virus may be severely underdiagnosed in Venezuela.
The limitation of the amount of tests prevents you from doing lots of them, but it may be greatly underreported. What we think the government is doing is mixing PCR tests and rapid tests. You cannot mix pears with apples. The numbers reflect different things.
Venezuelan hospitals are already struggling with shortages of almost everything. Only 70% of them have running water and soap. We spoke to Oscar Navas, a doctor in the state of Anzoátegui. He says he supports the call by opposition leader Juan Guaidó to pay extra money to healthcare workers that fight COVID-19.
A doctor like me gets $1.50 a month, and that's why my interim president, Juan Guaidó, will use some resources to give $100 a month to those who qualify and work in the health sector. The money comes from accounts that have been recovered from the government and will be paid as virtual money for 3 months.
Venezuela's healthcare system is already stressed to the limit. The spread of COVID-19 can easily make it collapse. Teresa, Al Jazeera.